Good afternoon. This is Media Center Ukraine, Odesa, and we continue with the discussion of the providing support to people free of charge. And we have with us Hanna Velichko, head of the Mental Health Center, and Olena Tarakanova, head of the Rehabilitation Department of the Multidisciplinary Hospital for Veterans. Good afternoon. And let's start with the following. Who can receive free inpatient rehabilitation care in Odesa? Good afternoon, everyone. I will start. I also work in the Odesa Regional Center for Mental Health, and I believe that today this institution is very important for our people. And we provide services to all categories of people because we provide mental and psychiatric support to people from 0 to 99. Since we are a regional center, any person residing in the region and IDPs can refer to us. We also work with the military and their families. We have several offices where we can provide inpatient care. This is 27 Kanatna and 9 Vorobyova Street, and also the village of Alexandrivka in the Odesa region, where we also have beds to provide free inpatient care. What is covered by this package of inpatient rehabilitation? In our institution, the advantage is that when a person refers to us, they get not only the support from psychiatrists, but we also provide a complex approach because every patient can get services from a therapist, neurologist. We also have dentists, so we can provide any type of help to people, including the oculist. Olena, I know that you work precisely with veterans. Yes, good afternoon, everyone. I'm the head of the rehabilitation department in the multi-profile hospital for veterans in Odesa. We also provide free inpatient care, and this is our main focus. We are the hospital for veterans, so our main target audience is veterans and the military. They are our priority. We have quite a large department for 60 beds. People can get inpatient care. We also were involved in the Pinchuk's Foundation, that the part of our department was renovated, and we have equipment that we need. But our main value is our professionals, because especially when it comes to inpatient rehabilitation, according to the service package of the National Health Service of Ukraine, we should provide 8 during at least 3 days. And the modern rehabilitation is a bit different from what we used to have. This is an active process, actively involving patients in rehabilitation centers. So we should speak about physical therapists, ergotherapists here. We also work with the mental issues, so people can get services from psychologists or psychiatrists. So this is how we provide service to our servicemen and servicewomen when it comes to modern rehabilitation. What traumas do your patients have? And they usually get to us after evacuation, or they could be referred to us from other hospitals. So those could be through mine explosions, the damages to brain, and this is the damages to their limbs, and also some with chronic diseases, because The strike would have been possible without significant pressure that they feel at the front line. As far as I understand, there are several stages to provide such rehabilitation support. According to the modern classification in Ukraine, we have 3 stages for rehabilitation. The first one is the acute stage, and it is ensured by the institution in intensive care units. And from the first hours, the rehabilitologist and other doctors should provide services to patient. Then, when the patient is referred to rehabilitation department, this is the subacute and long-term, and also there is the long-term stage that could be provided as a part of outpatient care at home. And these people could be referred to different clinics and hospitals. And what about the questions? So do we have them from the floor? Mikhailo, the floor is yours. Could you please provide more information about what has been done for the last months? Because rehabilitation issue is very important. And as far as I remember, your hospital has been reformed and the new rehabilitation center was opened. How many servicemen and servicewomen have get services in the opening for the last 2-3 months? Do you refer people abroad for rehabilitation or prosthesis? If yes, how many people have been referred? And the third question, how you as a professional can assess the state of the rehabilitation in Ukraine? And is it really helpful? Because all the time we can see the stories about people being referred abroad for rehabilitation, for physical, mental rehabilitation, to treat PTSD, and also for prosthesis. This is a question to you. And Anna, the same questions. How many veterans have received services at your mental health center? How many are in your hospital under constant monitoring or mental, psychological rehabilitation? And how the work of your center has changed after the full-scale invasion on the 24th of February last year. Shall I start? Yes, I will start. Because our center has been working for quite a long time. And I would like to start with the last questions, how the situation has changed since the 24th of February. I can say that our hospital was not primarily focused on veterans, or servicemen, or service women. That's why it was rather challenging for us, especially for psychologists and psychotherapists, because before the date, not all our employees knew how to work with veterans, and that did not happen on the 24th of February last year. Just several months later, we faced first servicemen and servicewomen, and we did not know how to communicate with them. That was very difficult. And the hostilities started in 2014, and I don't remember how many thousands of people from the Odesa region were involved there. And all these years, actually, I have covered that topic, and you say that you were not ready to communicate with veterans. We had some individuals, and we provide inpatient care in Kanatna and Vorobyova streets. And we have our tasks. These are different types of diagnosis methodologies, and we have a unit that used to work with veterans that in case of emergency, but not all our psychologists worked with veterans, despite the fact that the war started in 2014. We had theoretical knowledge, but not practical. Is it clear now? Why did not you organize rotation of the professionals? But this is not the topic of our today's briefing, that nothing was done since 2014. And now you say that you support those veterans with clinic cases only. And what is the number of such people? Today we know that we cannot disclose this information, especially when it comes to veterans that stay in our healthcare institution, and we named the addresses. That's why today we will just follow these recommendations of non-disclosure. You can say how many people you had before. I'm not asking about how many people are still there in Vorobyova Street, for example, but the whole amount of people that you have provided services to as of today, around 1,000 persons. This is when it comes to inpatient care, and we have outpatient rehabilitation, and we also, and our professionals, psychologists, psychiatrists, also visit military units to provide services there. And of course, the amount of people who have received that services is much bigger. Thank you. Olena? You asked about the number of veterans. I am not asking about how many of them are staying there, but the information about the number of beds in your center was disclosed during its opening. I know that I have some friends who had to go abroad because they could not get rehabilitation services here in Ukraine. What is new about your center? Because I know that international experts were involved in opening your center. So what's new? How many people have received services already into your center? And do you refer to people abroad if you can't cover the tasks with your center only? And rehabilitation department started operating on the 1st of January 2023 under the umbrella of our hospital. And over this time, we have provided rehabilitation services to more than 650 veterans. But our centers have been reformed. There has been renovation. And as the modern center, we started operating since the 1st of June this year. And as in the new format, we have provided services to more than 200 veterans. As when it comes to rehabilitation in Ukraine and in the Odesa region, it seems that it started developing only since the 24th February 2022, and because the challenges were new when it comes to the big number of the injured patients, patients with amputations, the amount of complex traumas. We have never seen anything like this before. That's why the quality rehabilitation and integration of these people back to the society is our main focus. At our center, if compared us to the old centers, the main focus is physical therapy. We have like physical procedures that are used, like laser, magnets, dealing with swelling, pains, and relaxation. But our main focus is on active tasks and exercises, and these are ergotherapy and physical therapists. This is kinesiology, for patients with injuries. And ergotherapist, this is a non-medical profession that deals with changing household activities for the patients, and the patient gets used to the new conditions and the new situation. These are such things as fine motor skills, the possibility to cook to yourself. This is very important to teach these people how to adjust to new reality and not to be dependent on the society or on their families, and to feel full members of the society. So you've provided services to several hundreds of people, and if you have ergotherapists, these are the people who learn how to live with amputations of limbs. Have you talked to people who undergo rehabilitation? Can you just tell us a bit about them? Could you tell us about the latest patient? What diagnosis he has? This is the secret. I cannot disclose it without names, without ages, without age, without the region, because I would like you to ask to tell us about people who get services at your healthcare institutions. How successful are they? Do they learn to live adjusted to the new reality? We can say that this is patient N, for example. He's 25 years old. He had severe damage to his head, damaging bones. This is the violation of functions on the right side. Before being referred to us, he visited numerous hospitals all over Ukraine, in Kiev, Lviv, Chernihiv. And no one dealt with rehabilitation in that patient. And when people are referred to us, we first define the objective of the rehabilitation, because rehabilitation should be individual. For some people, it's how to learn to go, to walk again. And for example, for women, and the main task is like cosmetics issues, to get rid of scars, not only to renew the function, but also to look great. And if we come back to our patient, the goal of that patient was to learn how to walk again, because before that he had not been walking for 6 months. When he was referred to us, we started teaching him how to walk again, but it is very difficult, because first you need to learn how to sit, and then to be able to sit down, to stand up. You need to work with the muscles of belly, to the muscles of hands, and then we can work with legs. Then the patient learns how to get up, and after that our patients can make first steps. We also had a patient with a polytrauma, and this is a story about how important for a person is to work. Now we ordinary people don't understand how happy we are that we can work. And our patients with the polytrauma, and he was referred to us from another hospital, from another department. And the first phrase that he said, I have not been outside for 3 months, and he wanted just to have a gasp of fresh air on the territory of our hospital outside. And that was the day of the birthday of the patient, and he wanted to work so much. So we just step aside from our protocol, and actually, but we decided to make a present to him. We allowed him at that stage to use crutches. We have a special system. It's look like a special backpack that is adjusted to the ceiling. And when he had his birthday, we allowed him to use crutches, and he stand up and worked. When it comes to the first patient, how long did it take for the rehabilitation of that person? Because it was the brain injury. This is quite a significant injury. The rehabilitation is still ongoing. Hanna, and can I ask you the same question? And just a week ago, we had a press conference roundtable dedicated to mental support and recovery of our veterans. And one of the professionals and experts who was invited, he told us that people not always understand to the depth and the spread of the these mental disorders accompanying the war in Ukraine among the military and among civilians. Can you agree with this? With this understanding, and we cannot understand the problem of patients with PTSD and 5-7 years. I cannot agree with what you've said, because I have 12 years of my practical experience at our institution, and on the contrary, I can see that our population and the military understand the necessity and importance of mental aid. Even when we visited military units, we were surprised to see how active they are in communicating with us. And when it comes to just ordinary people, civilians, we have a lot of people who refer to us. Teenagers and young adults who complained about their state, and they refer to us on their own, or they ask their parents to bring them to psychologists, and there are a lot of projects supporting this area, and all these groups, they have like a lot of people refer to them. There is a stigma to refer to psychiatrist or a psychologist, but and I think that people already get used that this is not how it is abroad. But people are not aware of the situation. They provide all data. All psychologists now have a lot of people referring to them. At our center, we'll also have telemedicine. So we provide services online. For example, if you reside in the Odesa region, you can't come to us, but you want to be consulted by a psychologist, you can refer to us online. And we also have calls from elderly people, because they feel lonely there. And sometimes people say that they don't have enough even force to cook something because their families left them. And we keep talking to our patient, for example, like a woman, and she says to us, you see, during that conversation, I was able to cook a soup for myself. And this is because she was just, there was a lack of care about that person. She needed someone to ask her how she felt. And during the conversation, she did something for herself, and only yesterday it was difficult for her to get up from bed. And psychological, mental support is very important now, and people, they refer to us, and I'm very happy about that. And when people come to psychologists, and psychologists see that there is perhaps needed the mental supports, and they refer their patients to psychiatrists, people don't say, oh my God, what's wrong with me? They agree to get that consultation. I would like to thank all the participants of the briefing. I have one more question, the last question. Just 6 months ago, Ukraine saw the project, which is named A Friend of Veteran, if I'm not mistaken, and now it is covering 7 regions. And this is about what you've just mentioned, how you support that elderly women. But in this case, there are people who can accompany veterans, both with disabilities or not, who need some mental support and the support and reintegration in the society after demobilization. Do you know anything about intentions to introduce this project in the Odesa region? And I will not talk much about that because there are a lot of intentions, and we've heard about that. But me personally, I don't know who will be responsible for that. I don't know about any plans to do this in the Odesa region. And now I'd like to thank to all the participants of the briefing, and we will continue at 1 p.m.
Дякую за ваше запитання.